I have the good fortune of being called in to address concerns with public health related to drinking water for most of my career. And a couple of them hit really close to home in the last couple of years. One was the Marshall Fire in Colorado that impacted our community where I live. And that was an example of kind of the new reality that we have to face in the drinking water community, which is our systems are more vulnerable to risks like that than they have been before. Would never expected a wildfire like that to impact the city of Louisville or the town of Superior, but it did, and it did so in ways that were impactful for the water system. Thankfully, in those communities, their water systems were resilient enough to, by and large, withstand the challenge of that, and they were able to recover very quickly. It was still hugely impactful, very devastating for the community, but as compared to other communities where the entire water system was lost due to a wildfire, it took much longer for them to recover, which was much more dramatic for impacting their economy, obviously the public health. I mean, kids just didn't get to go back to school for a long time because of that. And so the water system, in addition to providing drinking water, provides other benefits that have to be balanced. But another one that I think matters even more is we were fortunate to assist a community in Minnesota that was home, unfortunately, to the largest Legionnaire's disease outbreak last year. And Legionnaire's disease is caused by Legionella bacteria, commonly found environmental bacteria that causes Legionnaire's disease, which is a bacterial pneumonia. It is an organism that we should expect to find in water systems, but it should also be expected to be dealt with readily with a disinfectant residual. So another good example of a community that had to address a public health concern was Grand Rapids, Minnesota. We were fortunate to get called in to address a concern that they had, which became the largest Legionnaire's disease outbreak in 2024. And what was unique about Grand Rapids is that they were an undisinfected groundwater supplied water system. Totally allowable under the Safe Drinking Water Act and under state of Minnesota requirements. They had met every expectation for being in compliance. Free of other contaminant concerns and other bacteriological concerns. Unfortunately though, they became home to more than 30 cases of Legionnaire's disease and 2 people died. And it highlights the fact that the Safe Drinking Water Act still does have some gaps and isn't necessarily prioritizing what matters most for public health protection. And it's a key reason why I'm a huge advocate for us implementing minimum disinfectant residual requirements for water systems, but even more so, sharing the role and responsibility with the customers of water systems that have responsibility of managing and maintaining water quality in their buildings. Because you can't provide perfect water to the doorstep and then have it mismanaged from the doorstep beyond to people using it in their tap. Everybody's got to do their part. And so getting the message out about what everybody's role is really important.